Hello folks, welcome to another episode of All About Drug Addiction. My name is Doug and I'm a former benzo addict and a former, opioid addict. Really didn't want to do this video. I don't get anything out of doing these videos. My channel is not monetized. My webpage doesn't have any ads on it, but it's kind of clickbait what I put on here. My doctor cut me off. To tell you the truth, I'm not on anything that my doctor cut me off from, but I have been down the road of being addicted to Xanax, Ativan, and Klonopin, Oxycodone, Oxycodone, and that's about it. I have in the past, when I was addicted to benzodiazepines, ran out early. I saw a post today in one of these agony columns, these benzo agony columns on Facebook, and I reached out to somebody to help them with their taper. I recently released a video about the 45-day benzo taper, and it's just been shot down by everybody in these Facebook benzo agony columns. The only reason I joined these Facebook pages was simply to get the word out. I did this previously on how to get off opioids by using Tramadol. Everybody just shot that to hell and back. Well, the video's been out, and I got 2 videos on that, and it seemed like a couple of times a week I get emails from people who did the Tramadol taper, and they're like, dude, I'm glad you put that video out. I was addicted for the longest time and I couldn't figure out how to come off. My doctor would give me a taper and it wouldn't work. And I tried this, I tried that, doesn't work. And I just did your Tramadol taper. And sometimes they even say, I modified it and I used this and I used that. I'm like, okay, you don't have to follow it word by word. Same thing with the 45-day benzo taper. Like I said, I joined probably about 10 or 15 benzo agony columns on Facebook. And every post says, I'm anxious, I'm feeling bad, why am I feeling this way, blah, blah, blah. And it's just people, and it's understandable. People are frustrated with their addiction to benzodiazepines. And I know, I've been there. On the other hand, people are saying your 45-day is too fast, it's going to cause problems. And I'm just going to say this, that's bullshit, total bullshit. Oh, the Ashton method is the only way you can get off of benzos. Once again, bullshit. There's more than one way to skin a cat. Had this 45-day taper not worked for me, I wouldn't be doing this video and I wouldn't have done the previous videos. If the Tramadol taper didn't work for me, I certainly wouldn't have put a video together. And, I even thought about, why don't I just delete this channel altogether? I'm not addicted to anything anymore. I don't get money from YouTube. I'm not monetized. My web pages aren't. But I know what it's like to be addicted, and I know what it's like to think about your next dose, and I know what it's like not to have anything left, and then I know what it's like to run to the doctor's office like, I know I'm out of medicine early, but can you refill my prescription? And one time my doctor said, I'm doing it one time, and if you continue to take this medicine any other way than I wrote it, I'm not going to fill it again. I've also there's 2 or 3 different hospitals where I live. Run to the hospital, run to the emergency room. Hey, I just ran out of medicine. I don't want to go into withdrawals. Can you refill my benzos? Can you do my opioids? They all no. And here is another reason why you should really think about this 45-day benzo taper. Because your doctor can't cut you off anytime he or she wants to. They're not obligated to honor your prescription. Case in point, the doctor I had back in 2017, he upped and he moved his practice. He was the guy that was writing my Klonopin 2 milligrams 2 times a day. He was writing the script for that. I had a situation one time where I couldn't get the script filled because my insurance ran out on my car and I couldn't get a ride and I couldn't afford a taxi cab. So I went 9 days without Klonopin, and I actually thought I was going to beat it by cold turkey. But on the 9th day, I went into delirium and I started losing muscle coordination, stuff like that. And I went into full-blown hallucinations. After that, I actually went to a mental hospital where once I got there, I told them, I said, I am having these problems because I haven't had Klonopin in a long time. Well, they never gave me the Klonopin again. They couldn't have cared less. They totally doubted everything that I said. And while I was coming off that, they withheld other medications that I was taking, such as Oxycodone, 30 milligrams 4 times a day. And I went into not just a full-blown withdrawal from Klonopin, but I also went into full-blown withdrawal from opioids as well. And the doctor on about the 7th or 8th day is writing notes, because I've already got medical records back from this hospital visit. And he states that I'm having sundowners and Parkinsonian, and he thinks I have dementia. And what he doesn't understand is I've been telling him I am an opioid patient. I am a benzo patient. Please start me on my medicine and I will be well and I will be able to walk out of here tomorrow without having hallucinations. In ear, one ear, out the other. He didn't listen, and I stayed there. They were probably going to keep me there a full 30 days and try to kill me, because the doctor didn't understand that I was actually in full-blown withdrawal, and so he was not going to give me my Klonopin, nor was he going to give me Oxycodone or anything to tide me over. So you people keep talking about what it's like to withdraw fast. I know what it's like. I know exactly what it's like. Had it not been for the fact that I went into renal failure because I couldn't eat, I was too anorexic to eat, and it threw my potassium and sodium out of whack, and I went into renal failure. Had I not went into renal failure, they would have kept me there until I had a seizure and I died. After that incident, I went home, I got my head together, and I said, I have got to come off this stuff. A little while later, the doctor who was writing the prescription for the Klonopin, he upped and moved. And so I went to go see another doctor that I'd seen previously. And as soon as I got to the office, he's like, you want to come off this? And I said, hey, I really came here to establish a patient-doctor relationship again. But yes, I do want to come off this. And that's why I came here. So he was ready to write a script for me, and I go, no, please, save your taper, save your protocol. It's not going to work. I've been down this road with other doctors in the past, and their tapers never, ever work. I said, do you mind if I take some time to think about this and come up with a taper and get back with you? He said, sure. And the reason he said that is because he'd known me for many years, and also I was previously a nurse for 11 years. I worked in medical, surgical, rehab nursing, just almost every situation you could think of, clinical nursing, mental health, psych, methadone clinic, just all kinds of different stuff that I worked in. But I went home and I studied the half-life of Klonopin. Off the top of my head, I can't spit that out, but I know it's a long half-life. And I looked at the half-life of Xanax. I said, in order to come off the Klonopin, I need something with a shorter half-life. Because the longer the medicine stays in your body, the longer you're addicted to the medication. I knew this from 20 years of being an addict. So I selected Xanax because it has typically about 11-hour half-life. And there's going to be people that's going to respond to this video, and you're just going to pew, 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 pew. Try to shoot me down, but you can't shoot me down. I'm not taking benzos anymore, nor am I on opioids. So tell me who's wrong. You're still on the opioids, you're still on the benzos, and I'm clean. And I did it my way. So I came up with this taper, and it's called I call it the 45-day Benzo Taper. However, this taper is totally customizable to your situation. I just spoke with a girl today on Facebook, and she was just having a horrible time about her taper. I got a lot of information from her, and then I told her, I said, this would work for you, because basically she's only been addicted for 6 months. I said, this would totally work for you. She didn't throw the Ashton method in my face going, no, it's not going to work. It has to be the Ashton method. And, it's bullshit. The Ashton, whatever that method is, it's bullshit. This taper, you do 5 days, and I know it seems fast, but you know what a fast taper is? A fast taper is your doctor writing out a script and going, you've got 30 tablets of Xanax left, and that's all I'm going to fill it for. You figure it out. That's a fast taper. Now, I've had that many, many times. This is actually pretty slow because the half-life of Xanax is only about 11 hours. Your body has 5 days to get acclimated to it. 24 times 5. You have 120 hours to get used to that new decrease 11-hour half-life of Xanax. So let's say you start at 0.5 milligrams and you're decreasing your dose. And the sixth day you're going to start a new dose. You're going to jump down from 0.5 minus 0.125. Your next dose is going to be 0.375 milligrams of Xanax or alprazolam, whatever you want to call it. And so what is that? That's 2.5 tablets of 0.25 Xanax. You go see your doctor. You get the information. You print it out, which is on my webpage, and I'll put a link in the description. You get a script for 0.25 milligrams Xanax. You don't get 0.5s. You don't get 0.75s. You don't get the Xanax bars. You don't get the 1 milligram Xanax. He fills it every single time and writes a prescription every single time for 0.25 milligram tablets. Because every 5 days, let's say if you started at 1 milligram 3 times a day or 1 milligram 2 times a day, on the 6th day, you're going to bump down by 0.125 milligram. So you took 4 to begin with. Now you're going to take 3.5 for 5 days. And then the 6th day, you're going to go down to 3 tablets. And then after 5 days of that, on the 6th day, you're going to jump down to 2.5 tablets. And you see how it decreases in dose by a half a tablet every 5 days. That's all it is. And it's not fast. If you're thinking it's going to induce anxiety, all these other problems, it's not. And let's just say it does. Let's just say you do have problems with it. Well, guess what? It's not going to kill you. You figure out what the problem is. Well, I wasn't on, my cycles can't be 5 days. They need to be maybe 15 days, or maybe they need to be a month. But when you think about the dose you're decreasing, it's only a 0.25 milligram tablet broken in half. That's all you're decreasing. That's a pediatric dose. That's a geriatric dose of alprazolam. So if you want to do it every 5 days, you should be able to do it. But if you feel the 6th day you step down by 0.125 milligrams and you're feeling kind of flaky or weird out or schizo, all you got to do is go, let's go back to the dose I was on before, and let's just keep the cycle going. Instead of every 5 days, I'm going to do every 10 days. Or every 5 days, I'm going to do every 14 days. And if that doesn't work, do it every 21 days, every month. But all you're doing is decreasing by a half of a 0.25 milligram tablet. Anybody can do that. Now, when you get all the way down and your last dose is half of a half 0.25 milligram tablet, and you're just now taking 0.125 milligrams of Xanax, you do that for 5 days, or however many days you want to do it. When you get ready to finish that stage of the taper, you take that half tablet, and then you split that in half. When you split a 0.125 milligram in half, it now becomes a 0.0625 milligram, which is a microdose. It's like 62.5 micrograms of Xanax. You no longer take it 3 times a day. I'd say on the first day of the cycle, just go ahead and take it when you wake up. Make sure you have plenty of these microdoses with you wherever you go, and just go throughout your day. Go to work, go to the gym, go shopping, go theater, go hang out with people. Don't even think about it. And only when you start feeling that little nudge, he goes, you know what? I'd like to have another little microdose right now. It's not, your head's not going to be coming off. You're not going to be all just, skitzed out. You're going to be saying, I'd like to have that dose right now, instead of like this lady was doing that I talked to today. She was just totally out of her mind. Just fixated on anxiety, fear, Xanax. At this point in the stage, you're not fixated on anything. You have almost got this thing kicked, and like I said, you're taking a half of a half tablet now. You're taking a 0.25 milligram tablet, which you can break it in half. You're taking that and you're dividing it into 4 equal microdoses. And you only take it when you feel like taking it. And when you feel like taking it, your body's not going to be screaming at you. Your body's going to give you one of these kind of things. Like when you want something salty. I'd like to have some Lay's potato chips. When you'd like to have a cup of coffee. I'd like to have a cup of coffee. I'd like to have a slice of cake. I'd like to have a little bit of ice cream. I'd like to have some chocolate. It's going to be along those lines. Those aren't addictions. Those are just minor, insignificant craving. Craving is not an addiction. When you get down to this very, very last stage of the cycle, you're not going to be flipped out and, oh, I got to have my Xanax and where's it at and all that. You're just going to be, it's going to be a minor craving, kind of like a sweet tooth craving. And for all you people out there that got your head wrapped around this Ashton manual, I'm going to ask you something. How long have you been on benzos? How much longer are you going to be on benzos? And I'm going to segue back into what I titled this video. My doctor cut me off. I want you people to realize this now that I've already explained this Benzo Taper, that your doctor is not obligated by any law to continue your prescription to benzodiazepines. Though you may go, hey man, I'm doing this Ashton method, will you help me out? And they may go, yeah, sure, I'll help you out. But let's say 3 months into it, they're not feeling it anymore, and maybe they're getting pressure from other doctors who are talking like, you know what, man, I just got a lawsuit on these benzodiazepines. Yeah, I got a lawsuit on opioids not too long ago, and my insurance is getting raised on my practice. Well, you know what I'm going to do? That's it, man. I'm stop writing prescriptions for benzos for all controlled substances. I'm not doing benzos anymore. I'm not going to write a prescription for anybody for anything related to benzos or pain pills. And another doctor go, you know, I think that's the way that we got to go nowadays. Because this is the truth. This is the reality. They are tired of getting sued. What's worse is being frowned upon by other doctors, because doctors, especially newer doctors that have just gotten their license and gotten practice in the past 5 years, if you go see any new doctor, they will tell you flat out, as you're filling out the paperwork, we do not prescribe or refill benzos or opioids. Do you understand this? Check yes or no. Because a lot of people go doctor shopping and they expect to bypass the nurse and they get in there and go see the doctor and try to, throw their problems at his feet, and he'll go, oh, boo-hoo-hoo, here's a prescription. They're tired of that. They're done with it. They've washed their hands of benzos. I went to go see a doctor not too long ago, and I wasn't there for benzos, but that's what they said before I went to see them. I don't do that. I have been to other doctors in the past, like my doctor was on vacation and he had another doctor fill in for him. I go see them, and that's the first thing they hit me with. I'm not there to get my benzos refilled or opioids, but they tell me that. They tell you up front. They give you a disclaimer that we're not doing this anymore. And so I'm telling you this, if you're on benzos or opioids and you think your doctor is chill and they're going to be cool with you and they're going to let you just drag this taper out for months and months and months and months and months or years, good luck with that, because this is what can happen. Your doctor, like the rest of us, your doctor could have a medical problem, and the next thing you know, they're not practicing medicine anymore because they had a life-altering situation in their life, and they're disabled now, or they just died, or they retired. And I promise you, if those three things happen, or anything similar, and then you have to go see another doctor and carry your benzo or opioid baggage with you, they don't have to honor that. They don't have to go, well, boo-hoo-hoo, I know you're going to go into addiction. What they're going to tell you is you need to go to a clinic, a methadone clinic or a drug rehab, and this is going to how you're going to deal with it. And that's what you're going to be stuck with. You're not going to find another doctor that's going to continue your current regimen of benzos or opioids. It's just not going to happen. Now, I know there's people in the United Kingdom who watch these videos. I don't know what's going over in the United Kingdom. Okay, I just got a message on my phone. I don't know what's going on in the United Kingdom. I don't know how prescribers do things. But in the United States right now, You are very, very lucky if you can find somebody that will write you a script for a benzo or for opioids. It's getting easier to pull your own tooth with a pair of pliers than it is to find a doctor who would go, okay, I'll write that prescription for you. And that's why I named this video, My Doctor Cut Me Off. Because you people that are on these Facebook benzo pages and you're crying your little hearts out every single day, don't think I haven't been down there, and don't think that I'm making fun of you, because I'm not. I've actually went through full-blown acute drug withdrawal from not only benzos but opioids at the same time. I've actually become psychotic as a result of it. I've actually had days and days and days of diarrhea, days and days of not being able to eat anything, days and days and days of muscle cramps, and days of not even knowing what the hell's going on in life. So I've been there. I know what it's like. And only thing, my piece of advice to you people is right now, get off these benzos and get off these opioids as soon as possible. Because you may keep trying to keep yourself comfortable and nice, warm, and fuzzy feeling, and you don't want to just hit a bump in the road or anything. You just want to do this a long, long period of time. If your doctor drops dead or your doctor gets sued by somebody else, all it would take is for that to happen to them, for them to look at you and go, I know, I've been writing you a script for this for the past 10 years, but I'm not going to do it anymore. Or, your doctor died, I'm here covering for him, what can I help you with? Oh, you need a refill on your prescription? I'm going to write you a refill one time, and then after that, that's going to be it. You need to figure out how to get off the stuff. That's what you're going to be dealing with, people. It's really what you're going to be dealing with. Now, I know the haters are going to hate. You're going to flame me. You're going to light me up. That's okay. I don't have anything to worry about. You know why? Because I don't take benzos anymore, and I don't take opioids anymore. The sooner you get off this stuff, the sooner you get your life back together. The longer you stay on this, the worse outcome it's going to be. I promise you, it's going to be bad. Because if you look at the majority of people who are committing suicides nowadays, the majority of people who die young, almost every single one of these people either has a benzo in their system, or they have an opioid in their system, or they have an SSRI in their system. And then you go, well, they're a mental health patient, they need that. Bullshit. They're just like you and me. They have everyday troubles, and sometimes people's troubles get a little bit out of hand. They go to a doctor, and what does a doctor do? That should help you. That'll help you. And what they do is they create an addict in you. And what that creates for them is money. Because once you're addicted, you got to keep coming back. Got to keep coming back, forking out that money to go see them. And then what they're going to do is put you on some other medicine, like an SSRI or some other mood stabilizer. And they're going to tell you, you got this diagnosis and you got that diagnosis. Do you really have it? No. No, you don't. You don't. But now you got caught up in their wicked web, and you're going to be a lifelong patient for them. You're going to be a little cash cow for them. That's the way modern psychiatry works, people. It's not a benevolent form of practice. They have, in case in point, look at the DSM. What is it now, the DSM-5? I didn't plan on talking about this, but I promise you, the DSM-5 now lists behaviors, just normal everyday behaviors, as something as that you could classify as something you could put in the DSM. And if you can classify something, that means you can write a script for it. Regular everyday anxiety, just the frustrations of not making a good enough paycheck, having too many bills. That's now called a general anxiety disorder, which is bullshit. Because this anxiety will resolve itself when you get a paycheck, and when your bills get lower, or when you get on top of your bills, or you pay them off. But in what they put in their DSM, this is a problem. It's an anxiety problem, and we can fix that with some Xanax and some Zoloft and all that other kind of shit. And I'm just telling you, the longer you stay a patient, the longer you stay that cash cow, the worse it's going to get. Because your doctor could die, your doctor could retire, or your doctor could have a health crisis and not be in practice anymore. And then you take your problems that you had with them, that they were writing scripts for, and take it to somebody else. I promise you, you'll be spending a week of doctor shopping, and you'll be lucky if you find anybody to write you a script to cover you for your addiction, because they're not obligated to do it. They're not. So you really need to think about this, people. Anyway.